So in this session we shall talk about some of the common occupational diseases. Plumbism or lead poisoning is, is apparent from its name, is poisoning due to lead, and it is one of the common occupational diseases. Lead arsenate, lead oxide, lead carbonate are some of the lead compounds which are most dangerous and can result in plumbism. Lead sulfide is a bit less toxic. And lead is encountered in the occupations where there is manufacturing of batteries, or there is glass manufacturing, shipbuilding and braking, printing and potteries, rubber industry, paint, etc. These are occupations where lead is encountered, or lead is or a person is exposed to the lead compound. Gasoline, lead pipes and paint are environmental sources. Nowadays there is no lead added to the gasoline, but in older days the gasoline had lead added to it to increase its octane number. But lead pipes and paints are still there. There are three modes of absorption of lead into the body. There is inhalation, there may be ingestion, or it may get into the body through contact with skin. So up to 25 micrograms per ml is present in normally in blood. Levels greater than 70 micrograms per ml can give rise to clinical symptoms. Zero point 0.2 to zero point 0.3 ingested every day by adults through foods and beverages, that is 0.2 to zero point 0.3 micrograms. And majority of it, almost more than 90%, is excreted through feces, and the rest is stored in bones. So lead poisoning can be of two types. It may be organic lead poisoning or inorganic lead poisoning, and clinical picture in both these cases may differ a bit. In case of inorganic lead poisoning, there will be abdominal colic, there will be colicky pain in the abdomen. There will be obstinate constipation, loss of appetite, blue lines on the gums, which are also called Burton's lines. There may be basophilic stippling of red cells, anemia, wrist drop, and foot drop may occur. In organic type of lead poisoning, there is insomnia, headache, confusion, delirium, and effects on CNS. So how do we diagnose lead poisoning? The first clue may be given from the history taken from the patient. The history may suggest an occupation where the person is exposed to some lead compounds, or it may also give a clue to person's environment where there may be environmental lead poisoning may have occurred. Then clinical features, as we have discussed in the previous slide, those give a clue to the diagnosis of lead poisoning. Corpoporphyrin in urine is another method. Amino-levulinic acid in urine can be measured, which gives us a clue. Raised levels of these two can tell us if there is lead poisoning or not. Then lead in blood is measured, or can be measured, or on the under the microscope there may be seen basophilic stippling of RBCs, or red blood cells. So what are various preventive measures that can be undertaken for prevention of lead poisoning? These include substitution, where the materials containing lead are substituted with something else, some less toxic materials. The processes involving lead in the manufacturing or in industry can be isolated from the rest of the processes. There may be local exhaust ventilation there that results in clearing up of all the lead compounds from that particular area. There may be personal protection gloves and goggles and etc. Good housekeeping. The focus is on proper housekeeping, proper disposal of waste, etc. is done. The working atmosphere can be improved for control of lead poisoning. Periodic examination of workers, all the workers that work in such manufacturing plants or industries, they have to undergo periodic medical examination, where they are assessed for any signs of poisoning. Personal hygiene is very important, and finally the health education. So how is a case of lead poisoning managed if the poisoning has occurred? The first thing to do is to remove the person from further exposure, remove him or her from that environment where the exposure has occurred. A saline purge is done, where saline is given and output is measured, and it results in clearing up of some of the lead that is in the blood. Calcium EDTA compound is the chelating agent for lead poisoning. In acute cases, calcium and EDTA are given. Another common occupational disease is occupational dermatitis. It is a big health problem in majority of occupations. Physical, chemical, and biological factors may be responsible for this type of dermatitis. Primary irritants and sensitizing substances are involved. Preventive measures include pre-selection. People who already have any skin condition should not be involved in certain occupations. Protective gear should be given to those, and personal hygiene should be looked after, and periodic inspection of all the workers in such occupations. Certain occupations involve exposure to certain agents or certain factors or certain hazards, which may result in development of occupational cancers, carcinomas in the workers which are exposed to those factors. So these occupational cancers we will be looking at now. These usually appear after 10 to 25 years of exposure, and these may develop even after cessation of exposure. For example, if a person was exposed to the carcinogenic factor in certain occupation, say for a year, but after that he was not exposed, and the cancer may develop after 10 or 20 years of that exposure. Average age incidence is earlier than for carcinoma in general population. For example, if CA bladder occurs at a certain age in general population, the CA bladder in people who have been exposed to carcinogenic factors in certain occupations will be much earlier than that age. Localization of tumors is remarkably constant in any one occupation. You can clearly have association between certain occupations and certain hazards or carcinogens in those occupations with certain types of cancers. So occupational cancers involve skin cancer, lung cancer, CA bladder, and certain leukemias generally. Skin cancer is seen in workers who work with coal tar, or in workers who are exposed to X-rays or machine oils or dyes. Lung cancer is seen among workers in gas industry, in asbestos industry, in nickel and chromium industries, mining of radioactive substances, and arsenic roasting plants. CA bladder is seen in rubber industry, in dyeing industry, in electric cable industry. Leukemias are common among people who work with benzol and radioactive substances, and which are used in many industries. Elimination and control of carcinogens, medical examination, inspection of factories, notification of diseases, licensing for use of certain materials, personal hygiene and education, research, and approval of certain facilities for handling certain materials by the competent authorities. These are some of the measures that can be undertaken for control of occupational cancers.